So thank you all for listening. We're going to go over a quick overview of SalivaMAX and how it can be used in your office today. First things first is we know dry mouth currently is an epidemic. There's a lot of patients that are coming into your office with a lot of different issues, and we're happy to finally have a solution for you, for you and your patients. A lot of different things that we've heard throughout the industry doing research for SalivaMAX is a lot of feedback from patients, whether it's chemo and radiation patients or patients that are going through some sort of medication-induced xerostomia. There's a lot of quotes like, due to my chemotherapy, I have to butter my pills, or when I swallow, it feels like I'm swallowing glass. Every morning when I wake up, I have to peel my tongue off the roof of my mouth. So these are quotes that we've heard from patients that have been using SalivaMAX in the past, and they're very visual quotes that are happening in your office. These are patients that aren't just going through chemotherapy. These are patients that may be two of the 8 patients that you see every day. We did a survey with quite a few hundred dentists, and what we've concluded from the survey is that dry mouth is a lot more common than you think. The average dental office, of course, sees about 8 patients per day, and what we've learned is about 2 of those 8 patients suffer from some form of dry mouth. So it's really asking the right questions. It's understanding what your patients need and really where the dry mouth is coming from, because we know dry mouth causes a lot of different complications throughout the body. But some of the main things to look at are the causes of dry mouth. And we know there's a lot of different things that cause dry mouth. There's over about 400 medications that cause dry mouth, in addition to a lot of other causes like alcohol consumption, chemotherapy and radiation, of course, cause dry mouth, in addition to mucositis issues that we're seeing, nerve damage, open mouth breathing. There's a lot of different reasons that we've learned of dry mouth, but the complications as well are in abundance as well. We have a lot of different things, whether, again, it's severe dry mouth, or these patients that have difficulty just talking in general, or if it's just a minor xerostomia issue for patients. But we know that pH issue, increased caries, plaque, gum disease, a lot of different things that we're seeing. So the main thing that we've heard a lot throughout our research as well is the options for dry mouth right now. What do you currently recommend for your patients? What are patients trying to get rid of their dry mouth and really help their issue with dry mouth is all these over-the-counter options that we're hearing a lot about. So there are over-the-counter options, there are prescription options, and we're happy to explain to you more about SalivaMAX here shortly. But the one thing that we've heard throughout our survey was a lot of the dentists that we work with, about 86% of the dentists report that they recommend over-the-counter products that just don't work. We know a lot of offices that we work with, they do recommend Biotine or other over-the-counter options, and a lot of these patients that are dealing with it, they understand it just doesn't work. They're trying to use it, they're trying to relieve their pain, but with Biotine, we know it's mainly just coating the tissue and it's really masking the pain, whereas what we're trying to do is actually treat the symptoms. So when you look at Biotine, this is a quote that we've heard from a patient as well, that she suffered dry mouth for a lot of years, and she used Biotine every morning. And once she made the switch to SalivaMAX, she told the world of a difference. And it was a short period of time too. So again, in summary about dry mouth, we know a lot of your patients are suffering it. Again, 2 out of every 8 patients that walk through a dental office suffer and have some form of dry mouth. It's making sure that you're asking the right questions. Ask them if they have trouble swallowing. Ask them if they wake up in the middle of the night and they have to drink water. Multiple medications cause dry mouth. So understand what your patients are taking, so we can understand what we can help with them. If they're taking antibiotics or antihistamines or anything of that nature, we can really help out with these patients with SalivaMAX. And really, it's for you to be a hero. Your patients are complaining of dry mouth. They have a very large issue with dry mouth. Dry mouth is such a large market that nobody's actually been able to metric how large it actually is. The number of patients suffering from dry mouth hasn't even been quantified. There's a lot of patients that are maybe college students that are using study drugs, as they call it, and different types of Ritalin or Adderall, and these cause dry mouth as well. So it's all age ranges, it's all different types of patients. Just ask the questions so we have a better information for these patients, and you can be the hero. Our solution that we have is, as we'll go over here shortly, is SalivaMAX. It's a great option for patients. We've had great success with it, and we'll go over a little more of the details and the science behind SalivaMAX here.
All right, so one of the first questions we get is this FDA cleared? And it is. And these are indications for use for SalivaMAX. Essentially, we're looking at treating mucositis caused by chemotherapy and head and neck radiation, as well as xerostomia, really regardless of the cause. So how it works. So SalivaMAX contains ions that are missing in a xerostomic patient. The primary ones are calcium and phosphate ions. So on the left here we can see a before image, not a lot of saliva as well as few ions floating in the oral cavity. We can see after using SalivaMAX we have some of these greater concentrations of these essential ions that keep your oral cavity healthy. In addition to the calcium and phosphate ions, SalivaMAX also has bicarbonate ions as well. So SalivaMAX is really easy to use. It's non-systemic, it's a rinse and spit solution, and also it's very gentle. It doesn't have any anticipated side effects, and also there's really no known indications with other medications. So we're asking you to be the hero, and you're saying, how do I do that? You can be the hero by using a prescription form, filling out with the patient's information. SalivaMAX is reimbursed by most commercial insurances. Fax it into the number on the upper right hand of the form, and it'll be mailed to the patient. So here's a quick graphic on how to submit the form. The pharmacy takes it by fax and also by e-scribing. So one thing we're proud of here is that when it's covered by commercial insurance, that we pay the patient's copay for them. So it's about 60% of commercial insurances do cover SalivaMAX. When it is covered, the patient has no out-of-pocket costs. Secondly, if the patient has no insurance coverage, we want to have them try SalivaMAX for free to see if they like it. The pharmacy will contact the patient and then send them about a week's supply of SalivaMAX to have them try it. If they like it, they can pay the discounted cash rate. And if they don't, there's really no cost to the patient. Lastly, we have Medicare and Medicaid reimbursement. Unfortunately, government insurances do not cover SalivaMAX. However, the patient does have the option of purchasing at the discounted cash rate. However, because of government regulations, we're not able to send a free sample to the patient. Well, thank you for your time, and I really hope that just this quick intro to SalivaMAX, you can actually be a hero for your patient. Thank you.